Okay, Brandon, how are you doing?
I'm good. Appreciate it.
Good. My name is Nawood. I'm a physical therapist student at Rocky Mountain. So today we're going to be addressing some of the breathing issues, and I'm going to be listening to your lungs as well to see what can we hear, how your lungs are working. And okay, to do this, I'm going to show you a breathing technique to improve your oxygen intake. Okay, so when we breathe, we use a muscle here. It's called diaphragm. So this muscle helps you to expand your thorax, and it helps the air to go in. Okay, and one way we teach this technique is by putting one hand on your chest and one hand on the stomach.
Okay.
So when we breathe in, we want the bottom, your hand in your stomach, to go up. That means that you're using that muscle to breathe. So
Okay.
likewise. You see my bottom hand? Yes. Instead of your chest, when you use your chest, you're using other muscles. We want you to use the bottom, exactly. So we're gonna do like 4 repetitions of this. So breathe in through your nose and focus on your hand coming out, and exhale slowly through your mouth. Excellent. Again, inhale through your nose. Good. Exhale through your hands. Okay, one more time. Inhale through your nose. Yeah, feel the hand. Perfect. And exhale through your, exactly. Very good. So this technique helps you to decrease your work of breathing. Also, it helps you to slow down your respiratory rate, like how much time you breathe per minute.
Mm-hmm.
And also, it focuses on using that muscle that is meant to use for breathing, and you're resting the rest of the muscle in your chest and your shoulders. So you just focus on that. So that's the way that our bodies are built, to use that muscle for breathing and not other muscles, okay? And also it helps with the stress while we're doing that.
Cool.
Okay, so now I'm gonna be listening to your lungs. In order to do that, I will have to have access to skin, so I can put my stethoscope in your bag, okay? Are you okay? I'm taking your shirt off.
Yeah, that's fine.
Okay, perfect. Go ahead. Okay. So for the purpose of this video, I'm going to be using the diaphragm part of the stethoscope. Okay. Well, through this, Brandon, I want you to just breathe normal. Okay, and I'm going to be passing the stethoscope in your back. Okay. Okay, go ahead. Good, and I can hear clearly the air in and out. Okay. And I'm going to stay on each space for one complete cycle. Okay. Okay. Yeah, the noise is, as I get more in the middle, it's getting like stronger. I can listen it more clearly. Okay. Okay. Okay, excellent. You're welcome to put your shirt back on. Yeah. And I'm gonna be listening in the front as well. Okay. Okay, excellent. Good job. You're welcome to put your shirt back on. So our lungs are, they have lobes, so different lobes. And I was able to listen in the lower lobes, in the upper part of the lower lobes, some crackling. So that means that there is like a buildup of mucus there. And I was able to listen that in that specific part. That crackling means that there's some buildup of mucus, like I said, and that interferes with the oxygen exchange into your blood.
Okay.
Okay. So we're gonna do a vibration technique to help to clear that. Okay. So in order to do that, so I'm gonna explain it first. You're gonna be laying down on your side, okay, and you're gonna breathe in, and as you breathe out, I'm gonna put my hands on that area, and I'm gonna put a vibration with my hands.
Okay.
So that will help to loosen up those things. And in that process, you may want to have the sensation to cough. So we're gonna do a half cough. So it's not the harsh cough that we are used to. It's more like fogging up a mirror or a glass. So it's like, so that way you expel those mucus. And I'm gonna give you this so you can use it at the end of the breathing. You can half cough.
Okay.
Okay. Do you have any questions?
Do you want me to sit here? Do you want me to?
I want you to lay down, your head on, yeah, facing this way. Okay. Perfect. So I'm gonna put my hands like this. Okay, then lower portion. Okay, so breathe in. Good. Breathe in. Okay, one more time. It's working.
Half cough.
Good. Again, breathe in. Okay, excellent. Okay, that's good. So we will do this for 6 minutes, changing sides to clear both sides. Okay, do you have any questions?
No.
Okay.
Makes sense.
Okay, thank you for your time.
Yeah. Thank you.